on this. Hello, everyone. This is Tuba Fidan. I am LPC associate. I work with Uplift Counseling Services. Today, I have a guest. She is one of the therapists, Fatima Hanif. So I just wanted to introduce her. Actually, she can introduce herself better. Welcome, Fatima. How are you?
Hey, thank you so much, Tuba. I'm really glad to be able to talk a bit today on this webinar. Like you said, my name's Fatima. I'm at the same practice, Uplift, and I'm associate there as well. And I work with kiddos as well, so I do a lot of play therapy. So I know Tuba told me that that's what we'll be talking about today.
Yes. Fatima is Fatima is art play therapist. I work with teens and adults, and she is working with young ages. And that is so, I'm so glad that we have an opportunity to talk to her about play therapy, because I know her approach is like wonderful. Like she is very good at that, and I know she will give us very valuable information. So yeah, let's go ahead. It is gonna be kind of like discussion. We didn't prepare a presentation to share. I just want to go over some questions, and we will, kind of make it kind of like a conversation for us. Yeah. So Fatima, since you are a play therapist, you use this approach for your clients. So I just want to ask, what is play therapy? What's it about?
Yeah, great question. So play therapy, it's essentially a relationship between a child and a therapist. So pretty similar to therapy, but it looks a little different with kiddos versus adults. With a kiddo, play therapy, the therapist really tries to offer them a safe relationship, because this is the foundation of them being able to fully express and explore through play. So they might be able to process through play, whereas adults process verbally. And so just to give a general brief definition right now, it's just a safe relationship where they can express themselves.
Yeah, and there is also approach, like we call it child-centered play therapy. So how do you define this? Like, what is child-centered?
That's a great question. Yeah, there's so many different kinds of play therapies. The one that I practice is child-centered play therapy. And this specific version of play therapy has a lot of research behind it, a lot of practice behind it. It's been studied for some time now. It actually is from UNT. They have a child play center therapy where they do all this research. They do a lot of trainings. It's really rigorous and it's evidence-based. So it's shown that this version of play therapy is really effective. And it comes more from the lens of having a safe relationship, having empathy, believing that a child is capable. So it comes from a very accepting place for a kiddo.
Like, for example, I'm a mom, I have 3 kids. The youngest one is 3.5 years old. I play with my kids, right? I play like at home. Like sometimes he brings me his cars and he says, okay, you are gonna be the driver. I'm gonna be the this car we will play. Like, I am playing at home. Like, what is the difference? Like, what do therapists do at the sessions, and that makes them therapists? Like that makes them special in the therapy session.
Yeah, I'm hearing curiosity about what's the difference between play versus play therapy.
Yes, play versus play therapy.
I play with my kiddo all the time. Yeah, and that's a really good question, because it can seem like they're the same. However, play therapy, play is kind of the medium, the way that you communicate with the kiddo. However, you let them really be in control. It's a kind of a vacuum, a playroom that is tailored just for them, where they come in and they get to decide what they want to play with, for how long, what they do with it. And you're more of an observer at first, and you let them invite you. They have a lot of say into how they want this time and room to look for them. So there's definitely different skills as well that a therapist brings in. That'd be different than playtime anywhere else. And those are things that you can actually incorporate at home too, right? To foster that safe relationship to help them express what's going on and help them discover coping skills.
Yeah, sounds like they are more in control in the play therapy room. They just control their game, their like play, what do they want to play, which toys they are gonna select, and they may invite the therapist, they may not invite the therapist. They feel the control. So how do they process the emotions there? I just want.
Yeah, that's another really good question. You know, as adults, we might easily say, I'm sad, I'm feeling sad, or I'm angry. For a kid, it may not be as easy because they're at a different developmental stage. Their awareness of what sadness or anger isn't as recognizable as it is for adults. So for them, it might look different. It might be expressed in their play through different actions. It might be expressed through aggression or disappointment when something they wanted to happen in their play didn't happen. And for someone like a therapist or even a parent noticing that to say, oh, you're really sad that didn't work out, adds to them feeling seen and heard in the relationship.
And as I remember, Gary Lander said, like, play is their language. Play is kids' language. So I love that saying. Like, it's kind of we talk with words, they talk with play. Therapists understand that language, right? As a play therapist understand that.
Yeah, definitely. There's a lot of emphasis put on understanding certain emotions that come up in play, understanding what kids are saying in their language, and making sure that you're able to tell them that I see that in a way that they can understand.
So can we say toys, in the playroom, they have some kind of meanings in the play therapy?
Yeah, you know, at times, yes, and it really depends on how the kiddo's playing with it too. The items do represent a lot, but so does how they're playing with it.
Yeah.
So it can look like, you know, perhaps if there's a gun and like a police costume, if a kiddo's really excited and is just playing around with those toys and is just exploring the toy, that can mean something really different from a kiddo wearing those same toys and using that same toy to express control over something, to say, you're in trouble, I'm going to get you. That's a huge difference.
So their perspective is more important. How do they perceive the toys at the playroom? So I remember the same thing for sensory play therapy. The more important thing is, not the figures, like what they mean. More important thing is like, what do they mean? Like, what do kids mean by playing with that toy? Like, for example, it can be a doll. Kids can name it different. They can name it like a friend or enemy. Like, so their perspective is more important for us in play therapy. So sometimes moms are asking me, like, for example, for 4 years old child, they want to put them in therapy, and they say, like, can my child get talk therapy? Like, is it possible? What do you think about this? Like, what's the difference between talk therapy and play therapy?
Yeah, another good question. You know, it really goes down to developmental stages. For a kiddo, their brain looks different than it does for an adult. And talk therapy is traditionally used for teens and adults because parts of our brains are more developed that allow us to be aware of internal thoughts and to be able to verbalize those. For a kiddo, certain parts of their brains are still developing where that's not a common practice. Instead, what is a common practice is their play. So as humans, we find a way to communicate in the ways we know. And kids have a way to communicate, and that's play.
They communicate with play. And they make a connection with play, as I understand. I think that is the part of healing in the play therapy, because like building relationship with the kiddo in the playroom is very essential. So if therapists make a good connection, build a relationship with the kiddo, that's that after that change coming up, like change, that makes the change for the kids, especially for the kids like who comes with trauma. I'm sure you have experience with that. Can you give us an example about this?
Yeah, you've kind of hit the very core of child-centered play therapy, that the relationship, the connection that a child has can be so empowering. It can heal. And that's true because, if you think about your relationships in life and you think of someone that's been supportive, what were you able to do once you received that support from that person? Think of that for the child, right? If they are given the opportunity to have some autonomy that's developmentally appropriate to decide what to play with, when they want to invite you, to be given freedom to show anger in their play, to show sadness in their play, and for someone to acknowledge, to make them feel that I see your sadness, I see your anger. Imagine how that would feel for you, an adult.
Yeah.
It feels that you're not alone.
Validation from the other person.
Yeah.
That makes always feel better for the other parties. Like that makes like I am valuable. I am being understood. Like she listened to me, or my therapist listened to me. That's a great feelings, especially for adults. I mean, since I work with adults, I see that people are going to therapy for that, to be listened, to be understood, to be like approved or validated by someone. That is very important for us.
It's a human need, regardless of what age we're at. We just need in different forms.
Yeah, it's a human need, yes. And for the kids, I believe it's like almost same. Like they, for example, in a game, people makes rules. In at the school they play games too, but people makes rules. They sometimes restrict with the rules. In playroom, they are making their own rules. Like they are just ruling the game, and they are just like giving this restriction for the game, and they have autonomy for that. They feel like they are important. They can do that during the game, during the play.
Yeah, it's so valuable when you get to have control about something in your life. And for a child, that's difficult. There's not much a parent might feel they can give their child control for. At the same time, the child can really benefit from control if we give it in a safe way.
Yes, I was just looking for my other question. So since we are talking to the moms here, I just wonder how we can implement this play therapy approach, child-centered play therapy approach at homes. So is that possible? Like, what is the basic beliefs of the play therapy that we can implement at homes?
Yeah, it's definitely possible, and it's actually really impactful when parents choose to implement that with their kiddos. Because again, that relationship, when you use that version of play therapy, is the vessel for change. So with a therapist, they're seeing them maybe 45 minutes a week for a few months, or maybe a little bit more than a few months. But if a parent implements this can be present for a lifetime. A child can feel that constant support for a lifetime with a mom, with a dad. And this can there's so many skills you can take from play therapy into your house as a parent. There's a couple that I actually really encourage parents to practice, and I'm happy to jump into them. There's one that I feel is the crux of a child feeling seen and heard and validated. It's called reflective listening. And it simply is you being attuned to your child, hearing what they have to say and accepting it.
Yeah.
Not changing what they say, not saying, oh, you don't feel that way. Oh, no, that's not how we do it. Just repeating what you hear them say. When that happens, they know that you heard. So just listening and not changing. It's really powerful. And that can be hard at times, because as parents, we wear a lot of different hats. We are their caretakers. We also teach them in life as well. And so it's hard to know when to put that on and when to not. So I tell parents, aim to do that maybe 30 seconds a day. It's like learning a new language.
Yeah.
Yeah.
It is not easy though. As a mom,
Yeah.
I can say that it is not
Yeah.
easy to be patient, to go with the child emotions, to validate their emotions. Not always easy, but it requires so much energy, so much patience for the moms.
Yeah. Yeah. You know, it's hard not to be reactive when we, the adults, are already feeling so heightened,
Mm-hmm.
so upset. It's hard not to be reactive.
Mm-hmm.
The key is to try to be responsive.
Yeah.
So that means checking in with yourself a lot too,
Oh,
as a
that's a
parent.
great point. Checking in with yourself. Like,
Yeah.
because we carry so much emotions from our childhood.
Yeah. Yeah, we do. And you know, not just our childhood, there might be a lot of life stressors going on
That's
around us
so yeah.
that make us show up differently with our child. So yeah, the past and the present.
Mhm.
And so checking in with yourself
Mhm.
before you engage with your child is really important too.
Yeah.
And
Sometimes like emotion like regulation. It's
yeah,
affects our behaviors, our our how we are raising our kids. If we cannot regulate our emotions, then we cannot reflect that to our child, and it happens with some crisis, some crying. So we cannot we cannot regulate the other part if we cannot regulate ourselves. I can observe this with moms
yeah,
mostly, since I am working with moms mostly. So I see that like if mom is anxious, kids are also anxious or stressful like in life. So it affects the relationship a lot.
yeah. We model a lot of what to do with emotions.
Mm-hmm.
They're learning to emotionally regulate as well. And they learn a lot from caregivers.
Mm-hmm. There was a book about this happy parents, so peaceful parents and happy kids. That is
Mhm.
a great resource. Since I just remember that one, I can recommend it for the moms. Or there it's mentioned about emotion regulation, how we can regulate our emotions. There are some tips and techniques for that. We can find some resources. It is hard. If it is very hard, we need to handle many stressors in our lives, and we can find some techniques, some like tips for that. If we cannot do it by ourselves, we can get help for that. It is also normal. I know the life is busy and we just need to do everything at a time. Like, responsibilities are a lot. So we can ask for help. That shouldn't be uh, I know there are still stereotypes about getting in therapy. It's not easy for people. So but it is also okay to ask for help.
Yeah, yeah. You know, everyone needs support,
Mm-hmm.
and support can come in so many different forms.
Mm-hmm.
And this could be a form of play therapy, could be a form of support for you, your child, and it can also be really valuable where you're giving your child a toolbox of what to do with their emotions, how to recognize them, so that they can carry those skills later on in their life and use it in stressful times.
Yeah. If we go back to play therapy, I asked you about like how we can implement this approach at home. So, what do you think like why we are interacting with our kids like in
Yeah,
while they are playing, for example, they
yeah.
wanted to be part of the play. Like, how can we build a relationship with them? How can we build use empathy and we can approach with empathy, understanding with them? Like, what is your like suggestions for the moms?
Yeah. So, again, I'm going to stress the reflective listening because that gives an attitude of I am with you.
Mm-hmm.
But in addition to that, it's really powerful to have special you and me time,
Yeah.
special mom and kiddo time, special dad and kiddo time.
Mm-hmm.
This is essentially what play therapy does. It gives them a place to play where they lead and you come in with certain skills. But instead of a therapist, a parent's doing it with them. So they're again being the therapeutic change. And what this looks like is maybe 30 minutes a week. And you set out special toys that they don't get to play with at any other time. It's just their special you and me time toys. And you just confine it to a small place in a room. That way it's not spread out. That way you can stay regulated.
Mm-hmm.
just show up with them for 30 minutes and
Mm-hmm.
let them lead.
Yeah.
Let them lead and show that you're engaged. When they're showing excitement, show the same kind of excitement. When they're showing sadness, show the same amount of sadness.
Yeah.
They want to match their energy as well. Because then they're going to feel that, again, I'm seen, I'm heard, they care.
Mm-hmm. Yeah, they feel the validation, and and I believe kids get calmer when you play with them. Like I observe them many times. Like when, for example, right after coming back from the school, if I know we are all busy, we are busy with chores, like with cooking or doing some other stuff at home. So if you play, if you interact that time with the kids, like they get calmer and they respond like better with you, and they go with you because they are able to regulate their emotions. So it is the key, like emotional regulation is key to fix the behaviors. That is like just my observation, and and I understand with the sessions. So it is very important, and at the play also, while you are playing with your kids, like if you reflect if your feelings, like if you be part of the play but still give the autonomy to the kiddo, like to manage the game, like that works. I guess like that makes the communication better.
Yeah, yeah, it also helps when you're honest. When
Mhm.
you say, I'm confused, or if they know that you're sad, with you telling them that I feel this way and it's okay. Because you're right, it's honestly all about emotional regulation for
Mhm.
parents and children. And
Yeah.
so, again, the parents modeling how to emotionally regulate. And you can do that in the special playtime, right? By matching their emotions. And then if your emotion comes up, maybe just mentioning it and then modeling that it's okay to feel that and that you have a way to regulate yourself.
Mhm. Fatima, also for some traumatic, kids, I just wonder like how play therapy works for the kids who comes with traumatic experiences. Like
Yeah.
sometimes it can be sexual abuse, sometimes it can be like domestic violence or any other traumatic, problems. Like how does it work for the kids? Like can you? I know it's a very big topic. Just can you give us little information
Yeah,
about
it's another really good question. Essentially, the therapist shows up the same way. They don't show up any differently because this child is just as valuable,
that?
regardless of what's happened. So they show up the same way as they do for any other child.
Mhm.
However, we might see things differently in the playroom because the child might be showing up differently.
Yeah.
Maybe more hesitation,
Mhm.
uh, maybe feeling even uncomfortable with being alone in a playroom with a
Mhm.
therapist, an adult they don't know. And when this happens, it makes sense.
Mhm.
There might be worry about safety, and you can invite the parent in. At times, when I notice one of like a client of mine get anxious about being in the playroom for the first time, I let them decide. You can decide if you want mom to join us for today or if you want to come in alone with me today. And
Mhm.
that again gives them control. It reminds them, oh, I'm not being forced to do something. I get to choose how I want to do it. And oftentimes, if they are feeling anxious, they'll choose to bring their parent in with them. And I normally talk to parents about that this might be a possibility, and that's okay. Just come in the room and observe to see what this is like for them. So they'll oftentimes stick to the mom or the dad just as a safety figure. And slowly after time, when you start reflecting that they feel that way and allowing that, be like, it's okay to feel anxious. It's okay to be scared. I'm new.
Mhm.
Validating that feeling, you'll notice that they begin to regulate themselves because you're making a safe environment for them to feel that way.
Can we say they are healing themselves at the playroom?
Oh, that's powerful. Yeah, when you are given everything you need, yeah,
Mhm.
you know what you need to heal. You know what you need to do to heal.
They are processing a lot with play.
Yeah.
They are going so much emotional stages over there. Like they are processing a lot, whatever they feel inside. They are sometimes using the toys as a tool, like to talk their own language. Their languages play, and they are talking their own languages in their ways, and they are processing a lot. They are healing themselves. I think it is the kind of difference between talk therapy and play therapy for the kids. They cannot maybe talk with verbally. They cannot express so much emotions there when they need to do it verbally. But in play, they are just doing that by playing with the toys.
Yeah, it's important to trust them. Trust that they'll know what they need.
Yeah.
Yeah.
That's a great tool. One more question, then we can get the questions if they are, guests have questions. So what are some suggestions for the parents? Tips and suggestions for the parents, especially for the moms who wants to use empathical approach in their homes, like child-centered approach in their homes.
Yeah, that's a really good question, and one that can leave a lot of parents with tools as well. There's definitely beliefs that you can implement and practice, and then actions you can take. So I think there's two ends you can do. So we'll start with the beliefs. The beliefs can be that your child does want some control, and that's okay. And that's okay to give them control in a way that's appropriate for their age, right? And that could be special playtime, giving them a task around the house that they can be completely in charge of. Like, if your kiddo you feel is old enough, they can set up the table for dinner any way they want. This is their task. They know it's their task. They get to decide how they want to do it. Things like that, right? Giving them control. So that's a belief you can have and turn that into an action. Another belief you can have is what they feel is okay. They're allowed to feel what they feel. And you can turn that into an action by using reflective listening, by showing that you are with them, that when they're sad, when they're angry, you just reflect what you see. You can say, you are feeling really angry right now. You really don't want to do this. When they're crying, same thing. So you let them know what they feel is okay, and you see that. And that's the action you can do to go with that belief.
But sometimes that makes moms worry about what's the emotions. Right? Sometimes that mom gets more anxious, more angry when kids start crying.
Yes, seeing a piece of your heart in pain is really uncomfortable. At the same time, that may even require some reflection on your part. What is it about sadness that's making me uncomfortable to see? What is it about anger or yelling that makes me feel uncomfortable? There's a lot of check-in with you too. And at the same time, if, as parents, again, we regulate an environment for a child. So limits are needed at times. If a child's doing something that's harmful to them or someone else, limits are really necessary. And when setting a limit, if that brings up anger and crying, that can be tough to set a limit. But there's a way to do that, a way that provides empathy. You use that reflective listening, saying exactly what you see them feel and do, and then setting your limit. Saying, for example, if my kiddo really wanted a broken piece of glass that wasn't safe for them to play with, and I took it from them and they're really upset, I could say, you really wanted to play with that. And then I could say that, but this is not for playing. Instead, you could play with this. So always set the limit just clearly, and then give them an alternative. There's a 3-step process whenever you notice the parent is starting to feel unregulated because of something that doesn't feel safe for your child when they are feeling really heightened.
Yes, that is true. And also, like setting limits can be used for play therapy too. Is that correct? Like while they are processing, of course, They are not gonna act however they want. They have some limits. They have some boundaries there in the playroom.
Yeah.
We are just doing that kindly, like
Yes.
in an appropriate way, by giving the autonomy to the kids. Still, we are, respecting their the boundaries they played over there.
Yeah, you're right. Kids are given a lot of control in the playroom, but control that's appropriate for their age. And at times there are things that they try to do that isn't appropriate, maybe not safe for them or not safe for the room.
Yeah.
So yes, limits are used. That's teaching them regulation, teaching them what to do when they hit a limit, how to react, how they can process it, and what they can do instead.
Yeah, I remember we experienced this with my daughter. Like we had when I was getting the play therapy workshops, we had a set of like, how can I say, like the little playroom with the special toys, and we had a me and mom time together to do the play therapy. It was for my practice, but it was a great opportunity for her because it made us little, better relationship between us as a mom and daughter. So it can be used at homes. Like it is possible to do it at homes, even though it needs some more, some patience and, some special time because you need to, if you have more than one kid, I know it is hard to arrange a time. Just trying to be, give more time. Like it's gonna work with the kids. We just need to try to do that. Yeah. Thank you so much for these awesome answers, like for this discussion, Fatima. I just want to ask if anyone has any question. You can put it in the chat bar. We can answer, or you can unmute yourself and ask your questions. Any questions?
Hello.
Yeah.
Thank you. Thank you, Tuba, for asking almost all the questions we had in mind. So my question is how to work with when you have more than a kid. So I have a 4-year-old and a 2-year-old, and we try to be mindful to spending alone time, both me and my husband. But usually they will, especially lately, they will ask at the same time. Like, I'm playing with my son, my daughter wants me. She doesn't want to play with her dad. And this has just started. A couple of months ago, when I'm putting them to sleep, I was hugging my son, even though I had both in bed. And she said, "Mommy, I think this is not fair." And I was happy that she was able to say it, but also it broke my heart. And at the moment, I didn't know how to process it. I just said, "Thank you for telling me how you feel." And I said, as soon as baby brother falls asleep, I'm going to hug you. But she kept saying, "But that's not fair." It's not fair. And that was a first for me. So I still haven't processed it. It's been like 6 months. Thank you.
Oh, thank you so much for sharing that. And your question really does show how much parents are juggling, how much they want to be in tune with their child and connect with them, but also the reality of that they're doing that with more than just one child. And it sounds like your daughter was really, really aware of how she felt and was able to share with you, and you were able to understand how she was feeling, but at the same time, you weren't sure what to tell her to do with that feeling, or you didn't even know how to react to that feeling. And that makes a lot of sense. In the moment when it's hard for you to put your son down and give her what she needs, reflecting that she wants something could be a little bit of her getting what she needs, getting what she's asking for, by telling her, "You really want me to hug you? This doesn't feel fair. You really want me to be with you." And this might be a scenario where you can set that limit and even remind her that we can have special time, just like you did. But first, reflecting how she feels, because that really helps them regulate themselves as well. Their brains are jumping from, they're deep desires to reasoning, and kiddos' reasoning part of their brain's still developing. So by you mirroring what she's feeling will help her reasoning come into place, just until you're able to come back to her.
Thank you.
Yeah.
That is happening. That is happening when you have more than one kid. They will always feel at some points they will look for, like fairness, like you are doing this to her, you're gonna do this to me too, like, I know it is not always possible to be fair. That is, I remember this word from the sibling rivalry, the book Sibling Rivalry. It was also great resource for the kids rivalry. When you have more than one kid, and you cannot always give whatever they need that time. You cannot always, because you are one person and you have 3 kids, for example, or 2 kids. So it's not always possible. You can tell, now this is the time for this. And after, as she said, as Ornella said, like after he felt done, I'm gonna be with you. I'm gonna give you time, giving some more explanation, some, like feeling that sense, like you are gonna be with her, assuring the other kids will be helpful for the moms, I guess.
And even if it's hard to do that in the moment, repair is always possible. So when you do have time to be with her again after, similar scenario, once you put your son down, you can go back to her and say, you really wanted mommy to be with you then. It was really hard for mommy to do 2 things at once. Mommy's here now. So remember that. And, hopefully that helps with the discomfort you feel as a parent, not being able to show up in different ways at one time. That repair is possible.
Repair is possible. That is correct. Yeah. Any other question, guys? Like if you have any other questions, we can have it.
I was gonna ask one more last question.
Yeah.
Like, as a therapist, for us as parents, at what point do you think that the parents should be considering therapy, play therapy, or any other kind of it? Like, at what behaviors would, like, not necessarily like the big traumas, but like for us in the daily life, like what should we be especially looking out? What kind of behaviors, what kind of things should make us consider therapy?
Yeah. It's a really good question. Tuba, did you want to jump into that, or would you like me to?
I want to leave it to you because you are working with young ages more than me.
Yeah, that's a good question, right? Because there is this resource there about when do you need it? And there's various answers for that. But in a general way, it's when you see that your child is having something in their daily way they show up has changed, where it's hard for them to do what they used to, where it's hard for them to maybe go to school now, or maybe focus in school, or maybe they're not enjoying things they used to before. So if you notice a change in them, and also if your kiddo is having some difficulty in finding challenge with their emotions, with having really big emotions show up, and those emotions lasting for a while, and the kiddo looking like they do not know what to do with those emotions, that they are finding ways that aren't really helpful to deal with that emotion. So those are some two pretty big general themes that if you see that happening for a while with your kiddo, play therapy could be really helpful for them.
And also, if you see some behavioral changes with the kids, sometimes it can be wetting the bed. Sometimes it can be like a crisis, like tantrums, or sudden changes, that they can show with behaviors, because they cannot explain that with their words. They can show with the behaviors, right? They can reflect in the behavior. So that is also the sign that that kiddo needs play therapy, any kind of therapy. So yeah, I usually use those tips like this I go with the symptoms when they bring me the case like that. Like at schools, for example, sometimes kids are coming with different problems. Like I cannot sleep, like I cannot eat. For example, I had a student who was having hard time to swallow the food. And then we understood that she has anxiety. After we worked with anxiety, she started eating better. So they come with some, different kind of symptoms. We just follow the signs. What's going on? What's going on? What's the behavior, coming from? Like, where is the behavior coming from, and what's underlying it? So I think that is giving us idea too, right, Fatima?
Yeah, that's true. That's a change in how they show up, right?
Mhm.
There's changes in how they feel, but that also can change how they act,
Yeah.
what kind of things they're saying, because their actions are ways they communicate too. And oftentimes when we don't let out our emotions sit in our body.
Yes.
And they can turn into appetite change. They can turn into sleep disturbances, wetting the bed, just like you said, maybe feeling pain somewhere and it doesn't make sense. There's no reason for them to feel any physical pain. Their body can be cues too.
Yeah. Body keep records, right?
Yeah, it does.
Yeah. That was a great question, Ornella. Thank you so much. Do you have any other question, friends? Yeah.
Hi, I have a question.
Mm-hmm.
So I have a daughter, and she is very strong with her emotions. And what I mean by that is that she would anything happens, if she doesn't get it, she stop crying. I was just wondering, how can I handle that situation better?
Yeah. So it sounds like your kiddo, when something she doesn't want to happens, she has a moment where emotions come out that are really strong. And you're wondering,
Right.
yeah, and you're wondering what to do in that moment. And yeah, that is, I notice that a lot with toddlers, that is a really common occurrence. And it takes a lot for the parent and for the kiddo, for you, because sometimes those emotions are really a lot of stimuli. So it makes you feel uneasy. So there's a couple of things. Checking with yourself, already having a system of calming yourself down in the moment, so that way you can show up for your kiddo. And then in the moment, when you're with your kiddo, using those reflective skills initially. She might not even be registering it at the time, but saying that you were angry, you did not want me to take that, you really wanted that, saying that a couple times, and setting your limit, but this is not for blank, whatever she was doing with it, and then give her an alternative. Giving her an alternative is huge, because you're giving her control of, I wanted something, now I don't have it, what do I do now? You can even, instead of you can give her something else that was taken away. You can say, instead you could use this, or you can give her an open-ended option of, or you can pick anything else you can play with here. So giving her another option, right? You're regulating her by showing that you know how she feels. Then you're putting the limit, because limits have their purpose. They're important. And then showing her what she can do instead.
Yeah.
Okay. Thank you so much.
Yeah, it's a great question.
And also, sometimes, Fatima, I feel like physical connection is like a magic. If a child is approaching, if sometimes, they don't want to do that, they don't want to hug, or they don't want to touch you. But if child allows you, just go and hug. It's like a magic that time, like to calm the kiddo down. I don't know.
Yeah, she's a okay.
Yeah. But did you say? Sorry.
No, I'm saying my daughter, she's a big hugger. So so she's hugging all the time, but I'm not sure that time hugging is enough for her.
Yeah.
Like, for example, you want to turn off the show, and like TV time, right? You want to limit that, and that's like a big emotion comes out. And sometimes I am just not ready to handle that maybe, or sometimes it's just too much for me to handle as well.
Yeah.
So that I just wanted to ask a question that, you know, what is the best way to acknowledge or understand that the emotion is okay, just but you're not gonna get it what you want right this moment.
Yeah. You know, to encourage hugging too, and it sounds like your daughter really finds comfort in that. So even when you're telling her you're really upset, you can offer her comfort, right, in physical touch. You can also model breathing, like let's take a deep breath together. Once you set the limit, like, but this is not for playing. You can say, let's take a deep breath together. Because breathing really does have a huge effect on our nervous system and how heightened and how angry and sad and upset we feel, or how peaceful we feel. So when you're setting that limit, saying, I can give you a hug, or let's take a deep breath together, you're showing her skills she can use even in the future when she's feeling really angry or upset.
Sometimes hugging and talking at the same time.
Yeah.
Like if your child is okay with that, like, I know you are feeling very sad. Let me hug you and we can decide what you can do. You can do this or that, like giving choices. It's like in child-centered play therapy, that is the tool. Like you always give choices, right, Fatima? You are setting boundaries and you are giving choices. It is the like play centered means like it's not like freely do whatever you want to do. It's like giving some, you know, finding way with options or setting boundaries, that is also included.
Yeah, that kind of answers my question. Thank you so much. Appreciate it.
Thank you for your great question. Is there another question? Thank you so much, Fatima. That was a great conversation. I know your schedule is full. I know it was hard for both of us to arrange this Zoom meeting, but I am so grateful that we had an opportunity for this. I just want to take a picture, if it is okay for you. I know our attendants didn't open camera. You don't have to, of course. I just want to take a picture. Thank you. Thank you for attending.
Yeah, thank you so much for inviting me to speak about play therapy, and I hope it was fruitful for everyone.
Of course.
Yeah.
Thank you. Then, okay, have a great weekend.
All right. Bye.
Bye.